Good morning. My name is Francis Kohli, the County Police Commander for Bungoma County. And on mental health, all of us are affected as a community, and even the police are not left out. We've been having our share in this, and you've heard of incidences where the police kill themselves. The pressure is too much to them. You remember during the task force we talked about working environment. People are talking of the family pressure, and then again the peer pressure coming, as in those ones who have been lucky, they have developed when they share these stories. Those ones who have been in areas that are also affected, like operational areas, they have been engaging in fights, and they have never gotten these counseling sessions and also time with their families. You find that they are affected. What have we done to mitigate and address this? The National Police Service came up with the counseling services and partnering with institutions and hospitals, rehabilitation centers, to be able to encourage our officers to go for mental health meetings, counseling sessions. But as a county, I've held several meetings for police officers where I invite professionals to talk to my officers on the issue of mental wellness. And as we speak now, I've prepared another one, and I have friends from United States of America coming in partnership with Kenya Alliance on mental health. They are coming here, and also we are going to have this meeting, police officers and Kibabi University students, because they are also affected. So we will have a session that will combine the two, and they will have a session and they will take us through this mental wellness program, so that we start now addressing issue as a community together through community policing initiative, where we bring our youth and other police officers, and this will bring bonding between us and the students, so that they understand we face the same things they face as Kenyans, so that we move together to address this. So for us, we are saying slowly we are picking, and we are giving our officers avenues and members of the public avenues that there is an alternative here for you to come back, to bounce back and be yourself, than the feeding your minds with negativity. But we are telling them there is the positive side of life. There are challenges, yes, but there are other avenues, options for us to survive as a society. So we are creating opportunities for all of us to be able to see not only the challenges you are facing that will take you to the grave. Yes, we will go to the grave one day, but not too soon. We will go someday. We won't be here forever. We won't have money all through. Someday you won't have money, tomorrow you'll have money. Tomorrow your dreams to buy a car, yes, just maintain them, you'll have the car. But we are saying, how do I postpone my dream through these challenging moments? It's only just feeding your minds with the right information. And that's why we are bringing these forums, to create that opportunity for our officers. But that's all for now. But these engagements are on, they will continue even at the grassroots.
My name is Joy Wasilwa, and I'm the Executive Director of Grace Resources for Community Action, GRECA. At GRECA, we do many projects, and this time I want to narrow down to mental health in relation to substance abuse. We have been doing this program since 2021, and it came about when we did our first project, which was giving relief food to affected victims of the society. And we realized that there was more that was affecting the community, and that was mental health. We went ahead to work together with community health volunteers and counselors who we were sending into the community to fetch these drug addicts and other people who were affected by other forms of addictions, for example, betting, and in fact betting is really affecting our youth today. So what we did was that we were bringing these people to our organization, and then we take them through a 15-week program where we support them. We even do home visits, and we do support groups for them. So we have 5 of our clients who have successfully completed the 15-week program, and they are working with us as change agents. The second cohort, we had 20 of them successfully finish the program. This has been a major, it has brought a major impact in the community, and it has also led the local authorities to acknowledge our work. They have seen what we are doing in the community, and even the religious churches, they have also seen what we are doing in the community, and they really support us in this, because when these addicts recover, we ensure that we lead them to churches of their choices so that they are mentored there. Currently, we are handling the 3rd cohort who have just completed their 15-week program. We plan to have a completion celebration for them. That is just to acknowledge them and also encourage them to continue with their journey, because you realize that healing is not just something that happens once. Recovering from addiction is a process. So even if they have finished their 15-week program, we cannot say that they are fully recovered. They have to continue with the process, and we encourage them to do this by having them work with us as change agents. They are the people who, again, go out there to the Changardens to fetch more addicts for us, and they make sure that they bring their former friends and the people they've been drinking with, or rather they've been engaging in with them. So we plan to do this celebration in December, and we hope that their families are going to support them in this. We have 2 success stories who were the worst clients that we ever had. When we found them, they were on the verge of dropping down, and we took them to Haven Recovery Center, where they were given rehabilitation. And when they came back, they have done wonders in the community. One of them was a teacher, a primary school teacher and a Sunday school teacher. And right now he is focusing on talking to the community, talking to parents to encourage them to take their children to school. And the other one is a lady who has really worked well in the community, and in fact she has joined the community health volunteers, and she's doing very well with us. They're helping us with fetching more addicts, and we can say that we have seen a great impact in this community. So at the time when COVID-19 came, GRECA felt the need to assist the community. At this time we had 3 plagues. We had the floods, which had affected most people in the community. Their houses were being brought down and their crops were being washed away. And we also had locusts, which were eating the crops, especially maize. And we also had hunger that had been brought about by the lockdown during the COVID-19 season. So GRECA partnered with Harambee Center, and we did relief food to communities, and we targeted 100 families. So we were giving these households food that could last them at least 6 months. And we came to realize that it's not only these 3 things that I have mentioned that were affecting the community, because after it all, we still had people coming to us and requesting for more, and we could talk to them and just inquire how they were doing in the community, and we realized mental health was also a factor that was affecting the community in terms of development. And the second thing that was affecting these people was teen pregnancies, and this came about because we realized that schools shut down for at least 9 months. So that was the longest period of time that we had students staying at home with their parents. And there's so many things that came about during that time. One of them is teen pregnancies. So GRECA again came together and, putting our heads together, trying to find a way of assisting these young girls. We did approach Harambee Center, and that is when Harambee Center assisted us and escalated the matter to White Salmon Rotary Club. And since then, we have been on a journey to find a way to curb this problem in the society. And by that I mean that we came to form Najijali project, which basically means we are telling these girls that they come first in their own lives, regardless of whether they became pregnant at an early age or they've suffered other adversities. So we have taken these girls back to the college, the VTC, that is the Vocational Training Center, and there we are focusing on tailoring and dressmaking. We are giving them a 6 months training. And then after the 6 months training, they get into attachment, where they do 3 months of attachment. And then apart from the training course, we are also giving them wraparound lessons, which include entrepreneurship skills. We are also giving them mental health, and then reproductive health, childcare, nutrition, and basic domestic science. We realize that these girls need all these wraparound lessons because these are things that they need in their day-to-day life, apart from just the major course, which is tailoring and dressmaking. By the end of the training, we expect that these girls will be able to cater for themselves because now they will have been empowered, and we expect that they're going to take care of their families and their communities at large and their children. We intend to come up with a production center for the girls after they finish training, so that we can help them to care for themselves and have a central point where they can all work as a team. By that I mean that we can get them into a registered self-help group or a community-based organization, and then from there we can link them up with SMEP, that is a microfinance institution, where they will access small loans and be able to sustain themselves. We just want to appreciate all the donors, all the partners, local and international, and this includes Bungoma Rotary Club, that is Bungoma Magharibi Rotary Club. We want to appreciate the county government of Bungoma, who have really supported us by giving instructors and even allowing us to work at Chwele Vocational Training Center. That's where the project center is. So I just want to say thank you so much to all these partners. I want to also appreciate our international partners and donors. That's the White Salmon Rotary Club, Binjan, and Harambee Center, who is actually our mother organization. And we also want to appreciate all other Rotary clubs in the USA, because I know that there's so many of them who donated towards this project. The Rotary Foundation is our major funder, and I just want to say thank you so much. And I would also encourage all other like-minded organizations out there, those who are willing to partner with us, those who are willing to donate towards this project. We want to say that we still need your support. We cannot do this alone. So you can get in touch with us and we can find a way of working together. Thank you.
My name is Judith Ngeresa. I'm the Programs Coordinator for Grace Resources for Community Action, which we abbreviate as GRECA. I'm going to talk about our mental health program, which is situated at Namwela in Chwele. We have already had 2 cohorts that have passed through the mental health detoxification course, and the first people who passed through were 5 successfully, and they are out there as change agents. We also have the second cohort, 20 of them. They passed through the course and they came out successful as achievers, and they are also in the community making a positive change and impact. As we speak, we have the 3rd cohort, which is now ready for passing through the system because they have finished their 15-week course. So they are 20, and we are so proud as GRECA to announce that this program is doing a great work in the community. As we speak, the first 2 people who went through this program are teachers. They are acting as change agents, and it is Tito and Anam. They help us with the people who are substance abusers when they come. We work with them for the 15 weeks, and they help us also to go to the community to talk to people and help in the recruitment of others who are interested in the project. I want to say that the positive change that has come out of this mental health project, it has made the community members to be happy. They are interested in what we are doing, and what we are encouraging them is that people can change. Let them not give up on people whom they think are substance abusers and they cannot be able to do anything productive in society. We are inviting them to come to our offices at the Sikusi Junction, just on Chwele Bungoma Road, next to the Sikusi Dispensary, to come and talk to us and help us enroll their people whom they think will benefit from this program. Thank you.
My name is Rhoda Wamalwa. I work for GRECA, that is Grace Resources for Community Action in Bungoma County. I'm a project management officer, having had a vast experience working with issues of drugs and substance abuse. Through this mental project, we have been able to impact lives. We use a help step that is a tool that is comprehensive. Through this tool, we walk through the clients with them. It's a journey, it's a spiritual journey to wholeness. We have our weekly meetings on Thursdays at Milimo community-based organization. And through this project, we have had significant change and impact. Especially we have our 2 change agents who have been instrumental in impacting other clients. For example, they have embraced leadership roles in the community, in their churches. They are also supportive during our weekly sessions. They are the trainers, because one of the rules of the self-help program recovery is that the program, the sessions are led by one of the members or the members who've had significant change in recovery, significant time in recovery. So they are really supporting. And also, they are recognized. Our project, our impact has been recognized by authorities, especially in this county, Bungoma County. And our change agents recently, they were recognized by Haven Recovery Center. They joined the team in Busia during the anti-campaigns against drug and substance use, and they really supported the Haven team in reaching out to communities, sensitizing the communities through those sessions. And also through this program, we've realized that the clients have been able to assume responsibilities, and cases of dysfunctional families have reduced because the family heads have been able to assume responsibilities that they had abandoned when they were in full addiction. Another impact is we've had reduced cases of crime, because initially they would steal properties at home, even chicken, go to exchange at the brewing den with liquor. So we've had a reduced incidence of crime. Another impact is we've had families bonding, because we conduct family therapy sessions during our follow-ups, and we are able to get self-reports from families and how our clients are progressing with their families, and we realized that the relationships, the bonds have been established. And another impactful area is the clients have engaged in small businesses, projects like brick making, small shop businesses, farming. This has kept them being productive for their families. Another impact is children who are abandoned. We realize that these clients, when they are in full addiction, their children are not going to school. So as we did our research, as we did follow-up to establish that most of the children, they are attending school, because the family heads are responsible to pay their school levies and anything that is needed by the schools. Another impact is the clients have been able to create their own welfare. They support each other during hard times, challenging situations like funerals. They're able to support each other because they've set up a welfare committee where they contribute some amount of money to a kitty which supports them during the times in need. And another impact is they are also reaching out. The clients are reaching out to others. They are the agents of change in themselves. They reach out to others in the community who are in need, and they bring them, we counsel them, and we are able to enroll them into sessions, and we continue working with them the way we are doing with these other ones. Another impact is during the first phase, we graduated 5. Second phase, we graduated 15 recoveries. At this time, we are going to graduate 20 recoveries. That in itself is a success. And we've also realized from the local authorities, there's a call from the authorities that we increase our numbers. But now the challenge is our therapy is revolving and fixed. We have to finish with a certain group, then we enroll another group. So there's still that call, that outcry that we need to reach more people in the community, because the services are needed, since they've also realized the impact of our programs in this community.
Kwa majina naitwa Noah Manyasi, afisa wa shirika la Greka, na katika kitengo cha mental health tunasaidiana ili kwamba tukaweze kuwaleta hawa ambao wameweza kujiingiza katika madawa za kulevya, ili kuwaonyesha madhara ya madawa za kulevya na wakaweze kuachana nazo, ili kwamba wakaweze kujiendeleza maisha ya kawaida. Na katika hii shughuli ambayo tunaiendesha katika hili shirika, mimi kibinafsi Noah Manyasi ninasaidiana pamoja na wenzangu kuwafundisha wale ambao wameweza kuingia katika madawa za kulevya, kuwafundisha na kuwanacha ili kwamba wakaweze kutoka katika yale ambayo wamekuwa yakiyafanya. Kwa mfano, wale ambao wameweza kuingia katika vinywaji, wale ambao wanatumia bangi na mambo mengine mengi ambayo yanafanya hata afya zao zinadhoofika. Sasa kazi yetu sisi ama jukumu letu ni kuwaenda kuwatafuta, na tunatumia mara nyingi sana wale ambao wame graduate, wanaenda field, wanaenda kuwatafuta, na kuna siku ambayo tunakutana, na tunapokutana tunawaonyesha madhara ya haya mambo, na katika kuwaonyesha yale madhara tunawafundisha uzuri wa kuishi bila kutumia hizi madawa za kulevya. Na katika hii kazi yetu tunaona kwamba tunafanikiwa kwa sababu kuna watu ambao wameona uzuri wake, na kuna baadhi ya wale ambao wameweza kutoa ushuhuda kwamba hata hapo zamani walipokuwa wakitumia madawa ya kulevya hawangekopa hata kitu, lakini kwa saizi anasema kwamba akienda na hata kukopa anaweza pewa kwa sababu anaaminika, lakini pale zamani hangeweza kupewa. Kwa hivyo hii program ya mental health naona kwamba inasaidia hasa kwa generation ya saizi, na hasa mimi kama kijana, vijana wengi wameweza kuingia katika madawa za kulevya, na unaona kwamba tunaamini kwamba kijana ndiye kiongozi wa kesho, na tunaona kama kijana akiwa kiongozi, matarajio yetu makubwa ni kwamba tuwafundishe na tuwaweke katika njia iliyo sawasawa, ili kwamba tunapoishi tuishi vizuri, tusiwe na magonjwa mengi, kwa maana tumeona madhara ya madawa za kulevya. Kwa hivyo mimi Noah, kazi ambayo naifanya sana ni kuwanacha watu, kuwatafuta, kuwafundisha na kuwaweka katika njia iliyo sawa na ambayo inawastahili. Nashukuru.
Kwa majina naitwa Ana Mnamhula Viketi. Kuna miaka 43 sasa hivi. Natoka katika kijiji cha Mtonyi, location ni Namwela, ni Chwele community. Mimi mwenyewe nilikuwa mraibu wa pombe, na hiyo miaka yenye nilikuwa mraibu wa pombe hakika nilipitia kwa majaribu yaliyo mbalimbali. Mimi mwenyewe mara ya kwanza ni kuja kwa hii area ya Mtonyi, nyumbani maisha yetu ya kitambo sisi kwetu ulikuwa wa Kristo. Sasa penye nilikuja alafu nikaoleka nikakuja kwa hii area kwa hii area ya Mtonyi, nikakuta mahali penye ni kwa boma yenye niliingia. Nikakuta hiyo boma bila kuchemsha pombe, bila kufanya pusa, uwezi nunua sabuni, uwezi hata saa zingine ukula hata kwa kanyama, uwezi chipaka mafuta. Sasa mimi mwenye niliingia tu kwa hiyo boma, alafu nikaingia tu kwa hiyo hali ya kutengeneza pombe tu, alafu ilikuwa tu kusaidia sasa huyo mama mkwe kutengeneza pombe na kuuzia wateja hapo. Yaani niliendelea tu kuishi hiyo maisha ikafika mahali hata yeye mwenyewe akasema hata unanisaidia, lakini sasa hii pesa yenye nakupea ya sabuni peke yake iwezi kutoshelesha. Akanipaka kakapita kidogo, akasema enda ununue sukari pia ufanye nini, uanze kutengeneza changa yako na pusa yako, alafu pengine maisha yako iendelee mzuri. Hapo nilishika tu hiyo mita, alafu nikaendelea tu na hiyo maisha tu ya kuchemusha, kuuza. Ilifika mahali sasa maisha nikashika chini sasa kuuza pombe kabisa. Sasa kushika chini kuuza pombe, haya maaskari nao wakakuwa wengine wanatoka Namwela wakakujanga huku. Nikaendelea hiyo maisha tu, nikashika askari wakakuwa watu wangu, yani mabeshte. Sasa nikakuwa kama nimepata kitu na wape yako tarehe 15 na wape yako, sasa ikakuwa tu ni rendi yao na kuja kuchukua tu. Sasa penye Namwela naye ilisoea, sasa ikasoea, akasema huyu mama pengine anatengeneza hii chama lakini anapata pesa. Ikanitumia pia maaskari wasirisha nao wakakuja. Sasa ikakuwa tu ni mtindo. Mimi Namwela pengine nimeupea leo pesa wala siku na sirisha. Sasa zingine ni kama nimelala tu saa 10 usiku na sikia tu kwa mlango huku, hebu fungua mlango, sisi na afisa wapi. na Mwela. Siku ingine wote sisi ni maafisa kutoka wapi? Malakisi. Sasa ikakuwa tu ya mndito, nikaona sasa mimi nitafanyia tu kazi hii serikali hii askari tu. Nasema hapana, sasa kuanzia leo wacha ni sichemshe changa. Wacha tu niendenge tu nikichukua kama kamtungi huko kwa mahali penye wanachemsha. Alafu nikifika hapa na usa kama kwa haraka tu, nikimaliza naficha kila kitu, hata wakikuja usiku wasipate. Sasa siku nyingine nikaenda nikachukua 10 lita vipira viwili. Nikausaka alafu ikapaki. Sasa kupaki nikasema acha sasa nitakuwa mchanja, nikipaki na chimbia nje, nikachukua jembe nikachimba shimo, sasa naweka ndani hizo vibuyu ya chang'aa ndani hivi. Alafu sasa asubuhi niamke tu nichukue. Sasa kumbe venye nilikuwa nachimba hiyo shimo hilo huko nje nikiweka chang'aa, kumbe makastoma nao walikuwa wote hawajaenda, wengine wako nje. Sasa venye niliweka tu huko nje hivi, kumbe nao wakachomoa, wakaniiva, wakaenda naye. Asubuhi kuna mteja wa kwanza alikuja tu saa 11. Hebu nipeko chang'aa nitoe leo. Kwenda napata tu mashimo peke yake tu. Kuna chang'aa. Sema sasa ni nini tena nini? Nani alichukua? Kuulizia hakuna mtu yeyote. Nikaenda mara tena nikakopa tena pesa, nikaenda. Tena kuficha nje. Wakakuja tena wakaiba. Nikasema sasa waache kama hao ni wamekuwa werefu huku nje. Wacha sasa nichimbe tu shimo kwa nyumba yangu. Nikachimba sasa shimo kwa nyumba. Kuchimba shimo kumbe makastoma wenye wamekaa hapo wameona mahali penye nimechimba hiyo shimo naenda kuchukua. Kumbe ni mabechi wa maaskari. Sasa ilifika tu tena saa 10 usiku tena naona hao askari wa Sirisho wanakuja. Anasema wote fungua. Wanauzanga chang'aa. Nasema hata ninachukuanga tu pengine chiki alafu nauza. Huwa nakataa na chang'aa iko kwa nyumba. Nikasema kutafuta hadi kumbe wanaenda tu direct mahali. Nikasema sasa wacha nitembee kwa vituo nikuuza. Sasa msamaria mwema alikuwa ni Patrick huyu Sitati na huyu pastor wa Kube. Walikuwa sasa wako kwa Kireka Patrick Sitati wakakuja na Wakuba hapo wakaniuliza ana maisha yenye unaishi sifurahi. Akaniambia hata mimi nilikuwa masamani, uliniona nikikunywa pombe, uliniona maisha yangu penye ilikuwa. Nikasema ndio Patrick, mimi nakuelewa vizuri. Ulikunywa chang'aa mpaka ukapoteza kazi yako, kila kitu ukapoteza kwa pombe. Kaniuliza wewe mahali umefika unatakana usaidizi na mimi nataka kukusaidia. Kaniambia tuko na Kireka ni mimi na deal na Kireka Grace Resource of Community Action na inasaidia watu kama hao. Unaweza kubali tukupeleke mahali alafu hata ukae tu hapa alafu ukirudi utakuwa umepunguza chang'aa. Nikasema Patrick, kama uko na hiyo nia mimi nakubali. Hata akasema alikuwa ni Wednesday. Akasema Wednesday ukuja hapo kwa korofa hapo tukuanga hapa na Mwera. Kuja hapo kwa korofa alafu uangalia masomo yenye niko. Na kweli nilienda Alhamisi, aliniita Jumatano ya kwa hiyo Alhamisi next week nikaenda. Sasa nilikuwa sasa ikakuwa sasa too much. Nikitoka huko sasa ndio napewa chang'aa kabisa. Sasa venye Patrick aliona akasema wewe sasa kukusaidia wacha tukupeleke Haven Recovery Center. Sasa Kireka ndio ilichukua sasa hiyo chukumu ikanipeleka huko Haven Recovery Center. Haven Recovery Center hiyo kupitia kwa program kwa masomo hizi from step 1 mpaka step 12 ilinisaidia sana. Sasa venye ilinisaidia mimi tu kwa musi wangu nikasema kama ni uraibu wa pombe nimepitia hii miaka yote na sijaona chochote na nimeona maisha yangu ilikuwa sasa imesoroteka inaenda paka ukingoni. Wacha nifanye nini? Ni wachane na hii pombe. Sasa penye tulikaa huko Haven kama senda kwa hiyo siku 90 hiyo. Kweli niliona mafundisho yenye nilifundishwa hiyo ilinisaidia na nikapata uponyaji huko kutoka huko Haven through Grace Resource of Community Action. nikapata uponyaji, na hata kwa ajili ya uamuzi wangu tu nikiwa huko Recovery Center nikaitisha kupitia kwa maji mengi, ili kama kuna vile nilipitia pengine changamoto isiyo ya hii dunia tu nichioshe kabisa. Hata nikapatiswa huko, nikakuja huku nikiwa tu yenye niko hivi saa hii, nikikuja tu ni sasa nikakuwa sopa hivi. Sasa penye hata tulirudi tukafika huku, hatukukaa chini. Grace Resources Greka ilisema hakuna siku mtakaa huko nyumbani. Saa hii mtakuwa tu agent of change in Greka, ili pia nyinyi mfanye nini? Mtembee huku taani mkisaidia yako wenzenu wenye pia wameathirika kama nyinyi. Na ni hivyo hivyo, hatuchai kaa chini tukasema atapano pengine tukae tu pengine sisi kwa ajili sisi tumepona, waje wenye wanaumia na pombe huku waumie. Huwa tunashughulika, tunatembea huku mtaani, tukiwapata wasema hapana, sio pengine kupenda kwako ufanye nini ukunywe hii changa. Pengine unaweza kuwa na msukumo, ama unaweza kuwa pengine unasema tu mwingine unajiwakilia tu ati baba yangu alikuwa anakunywa changa, baba yangu alikuwa anachoa changa, wacha uendelee kukunywa changa. Sasa huwa tunatembea tu mtaani, alafu tukipea yako mawaida wengine wenye watu wanapitia changamoto kama hizo.
Titus Miruni Wanjaga, an addict who is undergoing recovery, an alcoholic addict who is undergoing recovery. I have a family, married, and with 6 children. Professionally, I was a teacher, but I was dismissed. My life history since I became an addict, it was when I went undergoing TTC, Teachers Training College at Kaimos, in 1992 up to 1994. I got peer group, my colleagues, who influenced me, and I started taking. Now, after which I was posted to Kisumu by then, but now it is Nyando County at Ahero, but I was posted in the environment where there was a lot of peer. So I was tipped in seriously. Now, when I was at home for a whole day, I had my elder brother who was also an addict. So we had a family affair problem, but he was weak, and as we exchanged, he collapsed and died, and I was arrested. Now, that was 2000 April. Then, as I was arrested, they gave me desertion of duty, after which, when I was still I got dismissal. Now, from when I was undergoing the murder case, they lessened it to be manslaughter because I did it during drunkenness, and I was released. When I came home, I had lost my job. Now I just roamed in the village, just sipping a lot of it, so that maybe I cannot have the what had passed. But it's when I got a lot of problem because my family was now affected. I was now responsible for my family as the father. But Cracker by then, through Good Samaritan, that was 2008, they took me to rehabilitation at Uranga, Good Samaritan. After which I graduated and came back, and my vision was to open an academy because I knew I had lost my job, but through my profession I can manage an academy. So I came and then opened 2009 an academy which did well in the community, but as it went on well, then I had a relapse again, and the academy collapsed. Now I went on just back to the normal life of drunkenness. How my family and my family suffered a lot. Even my wife went away, we separated, even children ran away from me. So I was just staying alone and looking miserable, just taking material things at home, taking to the brewing center so that I can be served for a sip. Now in the area, I had a lot of names. I was given a lot of names, whatever, and I was happy with them. Even the brewer, I came a servant of the brewer center, splitting firewood, drawing water at the well, being sent to the market, as if I have no home, but I had a home. As it went such a way, even if I met people who could help me on the road, I could run away from them because the way I was. Even I took my clothes selling to take changa. So I was just a hopeless person in the area. Even the community would not recognize me in any way. They just told me, said that I was a madman. It's when the cracker came and approached me and told me, or requested me to go to have an recovery at Eldoret. That was 2021. But I responded and I went because of the life I had passed through, because I was almost half dead. I could leave my house open, sleeping without closing the door even, because I was not eating. I lost your appetite. Even though I had food, I could just take to sell and go for a drink. Now my life at Haven Covered Center, that was 2021 in January. When my sense came, my senses came at normal, I responded to the request of Pastor Lawrence Wakube, who is the pastor in Kreka. Then he prepared me and took me with Sister Anam to Haven Cover for 90 days or 3 months. Because my response was positively, because I decided I should admit my addiction, and I knew I was a sick man. So when I went there, I was serious with what I was taught, and all the advice they gave me, I followed. And we started with we had 4 or 5 phases. The first one was we learned the physical recovery and psychological stability. The second one was to show the testimony of denial. We breakdown of denial, that is acceptance of the rehab. Then the third session was knowing court, and then that is through the 12 steps we learned of recovery. Then the relapse prevention. Then we went to the last phase, which was preparation for the discharge. That was 90 days. And I underwent well, and I was very serious because I wanted to change. Even I accepted to be baptized. So me and Sister Anna, we were baptized in February on 28th. And then in April, we came out of the rehab. Now, I promise that when I come out, I will not change, but serve our Almighty God from where He has got me. So when we came back, we have been recognized in Quaker as agent of change. Now we are helping the community, those broken-hearted friends who are also like we were, to bring back, to make them so that they can be transformed. The first group graduated in 2021, December. The second group graduated in 2022. Now, this year, we have also prepared others who are almost to graduate. I don't remember the number, but about 20 who are to graduate, and others are undergoing. We have new recruits clients who are still undergoing the teachings of 12 steps. We always move in the area, in brewing centers, convincing them to attend our lessons, which always we do it on weekly in every Friday morning hours, and they do respond well. But we as agent of change, when we move in those areas, we don't have the identification, so we sometimes risk our lives, because we can also go with the askar who moves around. So we request maybe the office to give us the identification, so when we move in those areas, we can be free to reach those brewing centers. Now, after I have been reformed from having recovery, the activities which I'm doing at home, I own a farm of 10 acres now, in a way so that I can be busy, because idle minds stables workshop. So I am always busy on my farm. I have planted coffee, and also to plant maize and beans, first season and second season. And I also practice daily farming, where I have 2 animals, one which I'm milking by now, another one is expecting. And I also prepare bricks and sell to to stand in for school fees for my younger ones. And so I'm always busy on my farm. At this time, I'm picking coffee, and I've planted sukuma wiki, which are ready now. Also beans are ready, maize are flowering, and I also have few chickens which I keep. So I am always busy on my farm when I'm not on the service of Quaker or in the church. I'm busy just in the farm. Anytime you come, you find me just busy. So I don't involve in other useless businesses, but I just mind my family and my work, which is all promoting me in one way or another. I'm not that way spending much on others like in the past.